Today we'll be having some interesting conversations on social health insurance expansion. I have here with me today the pharmacist Ajodi Nuhu, who has over 24 years of experience in the healthcare insurance industry. And we're looking forward to hear what he has to tell us today regarding social health insurance expansion. You're welcome, sir.
Thank you very much, madam.
So we would like to hear your thoughts. This is Bayelsa State. The health insurance program is going on. How can social health insurance be expanded in terms of its coverage? What are the key considerations?
Coverage. It's not an option, because Nigeria is a key signatory to ensuring that there's universal health coverage for its citizens. And as you are aware, universal health coverage means that no one is left behind, irrespective of your status, your tribe, or your religion. That there should be a cover, health insurance cover, right, so that people are able to access affordable and quality healthcare services. So Nigeria is on that journey to universal health coverage. We're talking about how to expand coverage. There are several ways. I'm aware currently that the Bayelsa Health Insurance Scheme has covered 100% of its former sector.
Yes.
Yeah, but there are also other areas that need to be covered. For example, we have organized private sector, and the new law has made this even much more simpler. You classify for organized private sector as those organizations that have staffs of from 5 and above. Of course, so we have SMEs that are employing people in the states that have employed about 5, 10, 15 people. It is the time to reach out to them to ensure that their staffs are covered. So that's one area called an organized private sector. And if you look at the matrix of coverage as agreed upon by the stakeholders, which includes the National Health Insurance Authority, the State Health Insurance Agencies, the matrix of coverage, all those organizations that are in the states with OPS, that meet the OPS criteria, falls under the purview of the State Health Insurance to cover. While the multinationals, that have like national spread, fall under the purview of NHIA to reach out to them. So you can also reach out to them. At the NHIA level, that is being done extensively. They apply regularly to be covered. That's one. Another area that one has to look at is that, health insurance is mandatory nationally, it's also mandatory at the state level. Now, how are you going to enforce the mandatoriness of health insurance? It doesn't mean that you are going to carry cane and flog Bayelsas or Nigerians that they must come. No, you can enforce this via social services. For example, you have schools here. You can say that, for parents, before your children enter primary, secondary, or tertiary institution that are located in the state, you must show your health insurance card. That way, people are encouraged to go and ensure that they enroll themselves and the family. Even the vulnerable, right? They have no excuse not to be covered, because you have the basic healthcare provision fund that provides for them. For those who cannot really pay, they should just make the same available for the State Health Insurance Agency, in this case, Bayelsa Health Insurance Agencies, to enroll them. And not just to enroll, but to ensure that when they are sick, when there is need for service, they actually go and access care, rather than just throwing money at the facilities and without utilization. That is very key. Well, another way you can also encourage enrollments for your high network individuals within the states whom God has blessed, and they are richer than you and I and others. They can adopt their community members. Yeah, they can adopt those who lived in their neighborhood. So a rich man can say, he wants to adopt 100 people and pay for them.
Fantastic.
Yeah, and that's will increase the cover. You have the politicians, those who are political appointees. They can also, adopt people. At the national level, we have distinguished senators and honorable members of the House of Reps who are adopting thousands. And annually, they make sure that there's a budget. Part of their constituency budget comes to NHIA to cover that. So those are the various ways you can ensure that you upscale coverage in the state. Talking about the informal sector, we can leverage on the structure of the traditional rulers and look at how they can help us mobilize, because the people will listen to their leaders. The most important.
But when you talk about the informal sector now, so that people understand what that means,
what is talking about those who are not village in the rural areas. There are also those the informal sector individuals that also live within the city. You have the vulcanizers, yes, they are fully paid. You have the what's it called? The traders who are in the market. They see incomes daily. You have your Okada riders, that is the informal sector. The way to bring them on board is to leverage on the fact that they have leadership. One thing about Nigeria and Bayelsa in particular is that these groups are organized.
Yes.
They have leadership. You can interact with the leadership and see how we can bring them on board. And they don't have to pay the premium at once. It can be arranged that can they pay quarterly?
Small portions.
Yeah, small portion.
Yes.
Can it be monthly? You know, based on, can it be even be daily? And you can do that once you digitalize your processes. Okay, on daily basis, you can even pay through your phone. Just pay a token, and that pays for the premium over a time. And once they reach the critical whatever amount that can provide cover, they are fully onboarded.
I'm sure people will be excited to hear about this.
Yes.
Because the access to care is something that should be prioritized.
Precisely.
Prior to the point where the care is needed.
Yes.
So that one is not put under undue pressure, and then it now becomes an emergency and you have to call so many people to raise funds. So this is really invaluable.
Usually, we don't have the culture of say, let us save for the rainy day in terms of health insurance. Because it's a premium. Once you pay, yes, agreed you may not be sick today, but sickness does not give you any notice that it's coming. And when it comes, it could be, God forbid, it could be children, it could be your relations, and that time is going to cost. I'll give an example of myself. My junior sister had stroke. Fortunately for me, I put him as on my panel on health insurance. And how much did I have to pay? At the national level, it's 15,000. Although inflation has come up now, once the new actuary is out, it's going to be higher. But it's far cheaper for me. And at the end of the day, I know that the money in treating her before she could stand on her feet was not less than #1 million. You can imagine what that has done for me. So I know the value of it, and I encourage our people to know that health insurance is for you, is for your good. After all, there's an adage that let us be our sister's keeper. Yes. Let us be our brother's keeper. Even if you are not sick and you are paying, the fact that somebody else from that pool, the money is being used to treat that individual, it gives one joy.
Yes, yes, honestly.
So, I think
absolutely wonderful suggestions, and I believe that people listening will understand this, and even the scheme itself is also paying attention to these suggestions. So there's so much to do with respect to social health insurance coverage, and we keep pressing on, and we encourage the Bayelsa Health Insurance and State Health Insurance Scheme to continue to do more and better. Thank you so much for having me, for being here, and we wish you a lovely day.
Thank you very much, but the administration of the Bayelsa Health Insurance Agency, their commitment is unparalleled to know.
Wow.
They have transformed this agency in a very short period, just within 7 years. So the board and the management, which is headed by Dr. Agada, they are doing a fantastic job. I commend them, and I sincerely encourage them that they should continue on this track. Thank you very much.